Please listen to Eddie Freed as he asks a very important question.
The Peekskill branch of the NAACP for this session. I appreciate it. In my question, I'm looking for both your immediate and long-term thoughts about things that we can do to address this issue. This is from the Health Committee. Across the nation and certainly across New York, African Americans are testing positive for the COVID-19 and dying at 3 times the rate of white people. At one place, it was 17 times worse. Lately, I heard 10 times worse. No matter what the statistics are, they're horrendous. Experts are talking about healthcare disparities. What will you do to address the immediate and long-term issues that make for this terrible statistic?
I mean, so first of all, we need to make sure that we put more resources yesterday into protecting those communities that are being impacted disproportionately. We need to understand why. So one part of it has to do with the work that they're doing, right? So I mentioned the bus driver, I mentioned the grocery store cashier. Those are jobs where they're coming in contact with thousands of people every day. They're at risk. They need to be provided. What the mother was crying about on television, aside from losing her daughter, was the fact that the giant stores were not providing protective gear for her daughter. They weren't providing her with gloves or with a mask. We need to make sure that all these people that were underpaying, again, because they also should get the minimum wage, they probably should get some kind of hazard pay, frankly. We're asking them to do these jobs where they're putting themselves in harm's way. And we aren't accepting the risk ourselves. And so we need to make sure that they have the protection, they have the gear. I am appalled at this current administration, because the federal government should be launching a nationwide effort to assess where the needs are for protective gear and for medical equipment like ventilators. And they should be running an organized system using the Department of Defense and FEMA, to get those things to the communities, to the places where they're needed. There is also an associated problem. When I listened to Lori Lightfoot, the mayor of Chicago, there was also a disinformation campaign. I don't know where it came from, but clearly leaders need to speak out and say, doesn't matter what your race is, what your religion is, what your politics are. This is a virus, for crying out loud, and it just wants a human to live in. And, so I think that's another aspect of this. But, then the other aspect is underlying health conditions. And then maybe that's the biggest one that I've heard about. And that's the one that we need to address as a nation. That was the one that was out there festering anyway, and the poor health care that we have. I am absolutely for a public option. I'm on the stupid Trump care, which is too expensive and doesn't provide me with great health care anyway, but it's okay. But I think we need a public option so that everyone's covered. And ultimately, when we talk about leveling the playing field, it's about education, healthcare, and housing. All of those things need to be affordable and accessible for everyone. That's what you start with. What you do with it after that, okay, fine. If you want to have a competition, but which we do as a society. But you have to start with something, and you have to have also ways to take care of those people who fall through the cracks, who can't do the competition. So I really do feel strongly about healthcare, and it breaks my heart watching what's happening right now, as I mentioned, because it's just so unfair, and it's fundamental, life and death.
I'm so grateful to you for that question, because I have seen so many politicians, whether elected officials or candidates for office, even in this crowd, bemoaning the disparities between Black and Hispanic people and white people in our society in terms of the rate of death from COVID infections. And here's the thing. So long as we live in a society which happens to be the richest nation in the history of the world, that does not guarantee health care for literally everyone in our society, we will continue to be a society where disproportionately Black and Hispanic people have underlying health issues that make them more susceptible to death from illness like COVID. I am the only viable candidate in this primary running on a Medicare for All platform that would literally ensure healthcare coverage for every single person in the United States of America. I think that healthcare should be a human right. I am under no illusion that that is something that will happen overnight. I was part of the Obama administration when we could not even get a public option passed. And so it is not lost on me the difficulty that would be associated with getting this done. But I'm grateful for the current Congresswoman, Nita Lowey, who agrees with me that we need a Medicare for All program that would cap the price of prescription drugs, for example, at $200 on an annual basis, that would do away with premiums and deductibles and copays, and that for 95% of Americans would actually be cost savings on an annual basis. We are spending an unsustainable amount of money on an annual basis in healthcare, and that number grows every year because insurance companies continue to price gouge, and so do pharmaceutical companies. And so that's what I'm fighting for. In the short term, we have to make sure that we are making testing and other treatment available free of charge. There are 87 million before COVID. There are 87 million people in this country who either were uninsured or underinsured, and that's people who have some coverage, but for whom cost is still a barrier to accessing necessary medical care. And you can imagine, with millions of people on a weekly basis being added to the unemployment rolls, a healthcare system where healthcare is tied to your employment is just not going to cut it. And so we've got to do better, and we can do better, but it means we have to elect someone who's going to be fighting for those things and not just paying lip service when it comes time to talk about a crisis. Nita Lowey has been a champion on that in terms of getting funding for community health centers, and that is a big priority of mine to continue to fund those.
Oh, wow. Well, there are several points I would try to address this. One is make sure we have access to affordable health care, which is Medicare for all. We have to make sure, no matter what, every American has access to affordable health care. Two, the conditions that African Americans have faced, whether it's economics or political challenges, social challenges, a lot of those, all those existed prior to the pandemic. The pandemic is now highlighting or exacerbating those conditions. So we have to make sure that when it comes to pandemics, our community is also educated about the spread of this pandemic. I know there was a rumor that this cannot affect us, but now we've learned that it can affect us. So definitely more education on how pandemics have an impact on us, especially in a disproportionate rate. So that's another thing as far as making sure that we address that issue. And three, on a social note, I want to just ensure that we as African Americans should not be stigmatized by this pandemic. We're getting to this ugly cultural norm that this is starting to become our disease. And I think that's easy to say because of the fact that we always get stigmatized when it comes to something bad, it hits us the worst. We have to fight back those social norms. And this is why I definitely support where we have a community coalition like the one Puff Daddy put together not too long ago, that we have to fight off those social norms, that this is the African-American pandemic. So I would fight this issue on many ways. Definitely access to Medicare for all, as well as education about how pandemics impact us disproportionately, as well as fighting off those social cultural norms that this is not our disease. I would say make sure that they have better access to medical services. That's the number one thing. And making sure they have the confidence to go to use these medical services, because for some, they don't want to go because they're trying to run away from the cost. Building their confidence, ensuring that you have to go and get yourself checked up when you are sick. So the number one thing, I would make sure that they have full access to medical services.
Sure. So I think it's a 2 or 3-fold problem. So first we got to diagnose it, because you can't fight what you can't see, as Muhammad Ali pointed out. And so the first thing we got to understand is, why is this happening? And I think that it's a combination of things. I'm not sure. We'll let the scientists weigh in and the public health experts, but it looks like, one, there's a socioeconomic correlation, right? So if you don't have as much wealth, you tend to have less opportunity to be insured, less opportunity to be having healthy nutrition, because nutrition is expensive, right? Bad for you food is cheap. It's cheap to go to KFC. It's not cheap to go to Whole Foods. So we need to like encourage folks to have access to better nutritional stuff, because what is a major risk factor for coronavirus is obesity and type 2 diabetes. And we know that it's just a brute fact of public health that the rates of those diseases go up both in communities of color, and not only the African-American community, but in other communities of color, because it's probably a socioeconomic thing. And I would guess that Appalachian white folks probably have some bad outcomes, but I don't know that Corona has reached there yet. But there's definitely an issue where we need to ensure that kids from the earliest stage in schools are taught to eat healthy. The Trump administration did a lot to undo some of the healthy eating initiatives. But that's an issue, and that's basically another human right. Healthcare is a human right in the 21st century, so we need better nutritional opportunities, and we need also to close the 8.5% uninsured gap in this country. So 8.5% of Americans don't have health coverage. That is why we need a strong public option to compete with private plans and fill the gap for that 8.5%. I guarantee you that 8.5% of uninsured tracks those who have less money, and this probably has a racial dimension to it, where more people of color are probably missing health insurance than other groups. And so we need to close those gaps so that people have nutritional access and access to health coverage throughout their life, so that they don't show up when a pandemic hits and already they're on the edge of health, because Corona takes advantage of those who have health issues. So I do think there's an unfortunate thing playing out here, and I think you're absolutely right to focus on it. So those are some of my main things. Make sure everybody gets insured, because it's a human right. Close that 8.5% gap, and then work on through schools and through our communities and urban planning at the local level to say what food options exist in our communities that are healthy, and what opportunities are there for public infrastructure, for exercise too. So for example, I know Peekskill's done some great stuff to build some connectivity to the Hudson and public pathways. We need to do more in that way. And the federal government can send money to encourage that stuff. Also, by the way, Governor Cuomo, who I worked for, and I think he's doing a great job now, Governor Cuomo got, I think, $10 million to go towards Mayor Rainey's work in Peekskill and having more recreational opportunities for kids. I believe that having kids be able to play sports, whether it's at the Boys and Girls Club or what Mayor Rainey's been doing, that sets us on the path to a healthy lifestyle. I played at the Boys and Girls Club in Mount Kisco when I was a kid. It was like the United Nations, when it was a bunch of kids from Central American immigrants kids, African American kids, me, all playing basketball in our filas in 1994. And that was great. And that was not only a great way to grow up, but that was, I see Roosevelt smile, he probably had those same filas, those Grand Hills maybe. But that put me on the path to a lifetime of exercise. And so I think that has a role to play, that kind of preventative early intervention healthcare, to avoid the health outcomes we're seeing now. By the way, I told Mayor Rainey that as soon as this thing thaws out, we're going to get out there and we're going to play some ball. So I'm looking forward to getting out to Peekskill.
Obviously important issue. So there's a few things. So first, I'll start with there's the HEROES Act, which is something that I support, which is before Congress now, that would provide hazard pay to our essential workers. That's extremely important. In addition, making sure that the right PPE is provided to all essential workers. That's something that unfortunately we as a nation have really failed. The other thing is a combination between the state and the federal government, and something I'm working on right now with Governor Cuomo is the HEROES Fund. And the idea there is that we have our essential workers that are on the front lines that unfortunately do not have the benefit of union protections. They don't have the benefit of collective bargaining, and therefore many of them don't have disability insurance and don't have life insurance. And I think that's extremely important, that these people on the front lines that have had our backs, we have to have their back. And so what the HEROES Fund would do is, God forbid, if someone did die of a COVID-related illness, that their family would receive a death benefit, so life insurance for them. I know that's something that I would obviously want if I passed away, that I would want to make sure my family is protected and has that a little bit of financial security. The other thing is, we've seen from COVID-19 that not only does it kill you, but it could cause a long-term debilitating disability. And that's why this Heroes Fund would be able to create a long-term disability insurance program so that if someone is impaired and unable to work, that they be able to get that disability insurance. The reality is that, yes, some of our frontline workers do have the protections of unions, thank goodness, and they do have some of these built-in benefits, but I believe the overwhelming majority don't. We're talking about our cleaning staff in many cases. We're talking about our grocery store clerks. And even some of our healthcare workers that are on the front lines are not covered and don't have those benefits. You mentioned, and one of the biggest discrepancies, so that's immediately, right, on COVID-19. But then we have to address what I think COVID is exposing, what we've already known, the massive disparity between, in this country, in access to healthcare. And that's something where we have to make sure that everyone has access to healthcare, to quality healthcare. And one of the bills that I was successful, and the governor actually recently signed during this crisis, is a bill called Dreams Law. It's named after Dream Shepherd, and she's a girl in Ossining who, when she was a little kid, a little baby, she was diagnosed with sickle cell. And she actually underwent a stem cell transplant that was really experimental treatment at that time. But now we've seen that stem cell transplants really work in a sickle cell condition. But anyway, when she was discharged, she had a stem cell transplant. When she was discharged from the hospital, she had an intravenous line into her heart. And what happened was her mother then, at the time, was told that she had to maintain the intravenous line and that insurance would not cover it. We find out that thousands of Americans die every year because their intravenous line gets infected. When you're in the hospital, only a trained nurse can maintain and clean that line. But once you leave the hospital, the discharge from the doctor is thrown out the window and the insurance companies don't have to cover it. So Dreams Law is what we passed, and it requires that now that the discharge plan is covered by insurance. So this is one of those things that is extremely important, will help thousands of people in this state. And I'm hopeful as a member of Congress, we can pass this nationwide, but also end this practice of where insurance companies can just play these games. You know, as a state senator, I've seen thousands, literally thousands of cases over my 10 years in the Senate, where the insurance companies play the runaround. They deny a treatment, they deny a drug or a procedure that someone needs. And I believe it's part of their whole business model, that there's so many of us that don't know to call their senator, that don't have the wherewithal or the ability to fight the insurance companies, and they just give up. And so many times our office gets involved and they're like, oh, okay, we're going to cover it. Well, you know, what was that all about in the first place? And they do that over and over again. That has to stop. So those are just a few of the things addressing healthcare and the response to the discrepancies that we've seen in how detrimental COVID is amongst communities in New York State.